Welcome back. The federal government urges health workers to stay, says Japa syndrome worsens the situation. That's what the Nigerian government is optimistic about. They're addressing the Japa syndrome, the mass immigration of healthcare professionals through reforms under President Bola Tinubu. Dr. Isiaq Salako, Minister of State for Health, emphasized that high salaries alone would solve the sector's challenges and urged health workers to remain patriotic. Salako also warned that Nigerians abroad remain second-class citizens and called on healthcare professionals to focus on long-term benefits. He promised increased funding for public hospitals and praised UBTH for managing power issues despite the challenges. UBTH's Chief Medical Director, Professor Darlington Obaseki, highlighted severe staffing shortages, urging the government to urgently address the issue to maintain service quality. He stressed that more healthcare workers are needed to manage the hospital's increasing patients' load. Our guest this morning is Mohammed Abdullahi, a public affairs analyst. Good morning and welcome to the program, Mohammed.
Good morning, Nigerians. Always my pleasure.
Okay. The government is saying Japa syndrome worsens the situation and asking health workers to stay behind. I'd like you to comment on that.
Yes, it's a good advice, but it's beyond words, and without sentiment, like I said, it's beyond words. It's beyond just making statements, and it's beyond rhetorics. It involves a lot of work and a lot of commitment by the government, and of course by the health workers as well. But in recent times, it seems the government is just very much obsessed with making such statements. I remember some few weeks back, in fact, some of the doctors or health workers have to be arrested when Saudi Arabia was always coming here twice a year, carrying out exams for health workers to migrate. But you don't solely blame the health workers seriously, because the challenges here is just too enormous. Aside the fact that the environment is very much, in so many occasions and so many places, very much unconducive for these health workers. The pay is very low, and so many conditions, working conditions, to the best of my knowledge, very pathetic. Very challenging. And then for every soul, for every mind, for every human, we always want the easiest way out. So it's like over the years, the Japa syndrome, particularly for health workers and tech people, it's easier to go abroad and make good money, even though you have to work, actually. You don't just get these monies, but at least you have to work. You work, you'll be paid as it went due, you'll be paid your remuneration according to your input. The situation is not like that here. It's just one segment of the society, which we all know. The politicians and their cronies who enjoy almost all the largesse here. So it's just beyond one, like I said. The government need to be more committed. If you allow me say this, the University Teaching Hospital in Ibadan, for instance, for more than 90 days or more, have been without power. I've been without public power. Only God knows how, what the management, patients, have been going through in such places. So, for people who have opportunity to go abroad, they won't think twice in such situation. So, like I said, it's beyond words. It's beyond just rhetorics by the government. We need to be very committed to make life much more easier for these health workers and the environment much more conducive for them to be able to or want to stay back to contribute their own quota to the health sector.
Yeah, okay. Well, one of the things mentioned by the government is that it goes beyond salaries. Even if you increase the salaries, it is not the solution that will come. I don't know if you are also on that page that it goes beyond salaries. the people should just stay behind. So if it goes beyond salaries, it's not salaries that will bring will keep the people back home. What else needs to be done? Remuneration, you have mentioned, is paid as at when due outside, and is paid according to the kind of work that you do. In fact, if you do overtime, then you are going to be paid overtime. In Nigeria, nobody knows anything about overtime. Overtime is not even part of our job description. You work overtime. It's a normal thing to work overtime in Nigeria. Nobody goes to work 9 and closes at 4 in Nigeria. It doesn't happen. You go earlier than 9, you close maybe by that 4 or 5 o'clock, maybe in local government or government establishments, and so on and so forth. So if they say salary is not the solution, what then is the solution? Put yourself in the mind of the government and try to make sense for us.
I think it's a significant part of it. Can't say I disagree to the statement of the Minister of State that salary is not part of the solution. It is a significant part of it, because remember, as you're working, perhaps even if you are single or you have family, you have to take care of yourself, you have to take care of your family, you're dependent here. And remember, this is a part of the world where if you are lucky to be earning, you have several dependents. If not, perhaps your immediate family, your extended family, your parents, your cousins, your nephews, your friends, and so on and so forth. So salary is a significant part. And aside salaries as well, like I mentioned earlier, on the conditions of service. You mentioned a very good point that we don't take into cognizance in this part of the world, which is overtime, for instance. Yeah, people, and in that sector, people are likely to work overtime, because in fact, sometimes you have emergencies, these doctors or health workers or nurses and all other people working in that sector have to, do away with their own personal life and their own personal enjoyment just to make sure that people are hale and hearty. So they needed to be, there is a need for this kind of commitment to be rewarded. You understand? Whether, yes, maybe not everything about salary, but condition of service, including accommodation, including housing, transport allowances, and so on and so forth, and some of the things that they stand to gain. You understand? What awards, for instance, what recognition, I beg your pardon, what recognition do they have? We see, for instance, in our national honors and awards in Nigeria, the majority, 80-70%, that the government nominates every year for the national awards are people who are in politics, who have hold one ministerial position, senatorial position, presidential position here and there. Yes, what other awards, what honors are given to some of these health workers who have distinguished themselves? They are very few, they are very rare, you understand? So these are some of the things that government need to look at. Yes, maybe not fully salaries, but like I mentioned, condition of service and all other things that ginger people, that will motivate them to want to stay. You understand? It's also very much important. Yes, if we are not talking about salaries, in my own opinion, is at least even 60-70% of what we talk about.
In fact, everything you mentioned are part of like salaries. It's something that you gain, something that you gain for doing the work that you're doing, and it doesn't always have to be just money. You mentioned the money, you mentioned accommodation, you mentioned so many other things. Those are gains that come to you. I count all of those ones as salary, it's part of your salary, and they are not forthcoming. But in the course of this discussion, we have mentioned the fact that, or you mentioned the fact that the University College Hospital in Ibadan has been without light for more than 90 days, and they were even promising them, the minister was promising them that in 48 hours, that was from yesterday, there was going to be light in that place. They were going to put a solar system and so many other things he was promising them. But it means that infrastructure is not in place in the health service or healthcare sector. So if we have to start a reform in that sector, where do we start from? Is it from power? Is it from the other infrastructure? Is it from the drug availability? Is it the staffing or employment? Where do we start from?
I think, in my humble opinion, we needed to start from a place where these politicians take, I mean, they take pride in accessing Nigeria's own health infrastructure. By doing so, I tell you, a lot of things will improve. If, for instance, the president, let's start from the president, the ministers talking, I mean, making statements, and all guys, there's a mandatory law here or mandatory policy that all public office holders must access healthcare in Nigeria. I'm telling you, some of these loopholes that we talk about, that we see, will be fixed immediately, because they will understand that they will see firsthand the plight of the ordinary citizen, and then since they are also going through that or passing through same experience, it won't take much time for it to be fixed. The challenges we keep having in Nigeria is the fact that there are different experiences for the different strata of the citizens. You know, shockingly, the people who are in charge of government have different experience entirely compared to what these ordinary citizens like you and I go through every day in the country.
They are the band A Pro.
Sorry?
They are the band A Pro Max.
Yes.
You know,
yes,
now we are in band
yes,
A, band B, and all that. Even if it's in power, we know that it is something that translates into every other part of our lives. Yes.
You captured it perfectly. They are the band A Pro Max, paid by your tax and my tax. That is the authority of it. You understand? So if at least there is at least a level playing ground where some of these things are experienced by both parties, you know, it will go a long way in. For instance, for God's sake, 90 good days for a place patronized by all and sundry, like the University College Teaching Hospital in Ibadan, without public electricity. They have to carry out surgeries, a lot of things, emergencies, and without public light. You know, how do people, only God knows the amount of casualties that have gone out of that place, you know, in the past 90 days. You understand? It has resulted in protests. Even student doctors who are learning are protesting, you know, because how is such a place conducive for learning, for the patients, for even the management, and so on and so forth? If the minister, for instance, who is from Ibadan there, the minister of power, perhaps I am not wishing him bad, but if he's had headache perhaps in the past 90 days and resorted to visiting the UCH, perhaps this would have been tackled speedily. You understand? Because these things are faced by ordinary Nigerians. Nobody cares. It takes a lot of haggle and hassle before things are done. So to answer your question straightforward, if the reform we need is that we need a policy or even a mandatory law to make our government officials patronize made in Nigerian things that are done here. Their health care, there's the schooling of their children, and so on and so forth. If they do that here locally, I tell you, a lot of things will change.
I remember when El Rufai put his son in school here in Nigeria, and it didn't take up to 2 terms. He withdrew the child because of security reasons, and that was the end of it. Nobody heard anything about it. We were clapping for him that, okay, he has taken a bold step, and because of that, there will be security in schools. He will look into the matter and all that. But before we knew it, he had just already withdrawn his child from the school. So I don't know. These people have the opportunity to go to wherever and access whatever it is that they want to access. We cannot, because we are I remember the time in Buhari's time when was it the First Lady or so visited the Abuja clinic, the Abuja hospital, the Aso Rock hospital, and said that there was nothing like paracetamol even in that hospital. And I was wondering, right under the nose of the president, that things will be looted and people will be so lackadaisical about their job. And nobody was fired. I'm not sure that there was any head that rolled because of that incident, but here we are. This is the same Nigeria we are.
It is budgeted for every year.
Yes.
And the fact remains that there was not even sign of paracetamol in that hospital.
So it was terrible. But now, some people are of the opinion that even the health sector should be privatized in such a way that it's private individuals that run even the government-owned hospitals and all that, so that things will be working well. While the government audits them and does other things, the day-to-day running of these hospitals should be left in private hands. Do you also buy that kind of idea?
No. We can't keep running away from, the issues and thinking privatization of everything will solve things. I don't believe that. Seriously, Nigerians are grappling with a lot in terms of cost compared to what they get as revenue. So if you are privatizing the health sector entirely, I tell you, it will be out of the total reach of the ordinary Nigerian. Today,
a case in point is that recently one of the ministers came out and said that foreign nationals come to Nigeria to access medical care. And this was confirmed by or at least corroborated by some other individuals that have been serious critics of the government. And so you will say, okay, if they are they are talking for the government and saying that these things really happen, then maybe there's some element of truth. But we know for a fact that these foreign nationals that may be coming into Nigeria to access this may not be coming to somewhere like the University College Hospital that you know, all government or public run hospitals. They're coming to private hospitals that are in Nigeria and doing really well. So why can't that be replicated across board so that we can have a standard healthcare, and then the government will just subsidize it and then monitor them and all that?
Let me burst your bubble, please, a bit. There's also a school of thought. I've also read some critics talk about the fact that yes, while the vice president's statement, because the vice president also make a statement that foreign nationals are coming for
yes,
perhaps kidney and so on and so forth. You know, there are also critics who are saying, yes, we might be seeing this as an achievement, but again, it might be as a result of the fact that there are cheap kidneys and other organs to be sold here in Nigeria. You understand? So anyway, that's
an angle I didn't think about. That's serious.
Yes, I read something like that, and it's really opened my mind. It might be true. It's very possible.
Makes sense.
But anyway, that's not our bone of contention. But what I'm just trying to say is, when you privatize everything and make things really, it becomes too expensive for the ordinary Nigerian. Seriously, yeah. Because even now, with what we have in our so-called general hospitals, that is highly subsidized, average Nigerians are finding it very difficult to access. When I mean access, I mean pay for normal healthcare services and delivery. So if you privatize everything that goes into the private hands or private corporations whose sole motive is profit, it becomes very, very challenging, seriously. So I think I don't really buy that idea that we must privatize everything. There must be a level of government control and government ownership to some things. In fact, particularly healthcare, that is so critical. Remember, you take people to these private hospitals, for instance, they don't admit you without making a deposit or paying a deposit as it were. So, and you have perhaps in Nigeria where, we don't have, how many people, for instance, there was a report late last year, that less than 20% or even 10% of Nigerians have 500,000 naira in their account. So you have just a little, in fact, it is a well-known fact in Nigeria that we are all, the majority of Nigerians are just one major or critical illness away from being a beggar on the street or on the social media. Seriously, before you know, you go to social media every day, you see crowdfunding for somebody who's have cancer, who's have to go undergo kidney transplant and so on. In fact, even including our celebrities. I don't want to mention them, but we've seen celebrities who have passed on, maybe in the movie industry, who we think are really doing well, and just one sickness, bam, we are crowdfunding. So if you complicate the issues by saying government hospitals must be privatized so that they can deliver well, what we are saying is that we should also be very ready for high cost, which I don't think ordinary Nigerians are adequately ready to pay for at this moment.
Well, I'm going to eat more fruits and drink more water and hope that I'll stay healthy and not be sick enough to go and look for help, which may not come because everybody is struggling at this point now. But this is where we have to draw the curtain, Mohammed. I would like to thank you for being a part of our show this morning. As always, it's been a pleasure having you.
Thank you. Good morning, Nigerians.
We've been talking with Mohammed Abdullahi, a public affairs analyst. We were looking at the healthcare system where the government is saying that the healthcare workers should stop leaving the country, that leaving the country is not the solution. So what else is the solution? And if we know what the solution is, why are we not putting that solution in place so that the people can stay back? This is at this point we are going to take a short break, and when we return we'll be talking about something else. Now we were looking at health care. We are going to move to something else. Just stay with us.